Once I sit down with you and I do an examination of your legs, ask you a few questions, I can come to a pretty close determination as to whether or not you have venous insufficiency. But the only way to definitively diagnose if you do have venous insufficiency and to what extent is to get an ultrasound performed on the legs. And what we're looking at specifically are the veins in your legs. We do a vein mapping procedure where we're actually looking at the diameter of the vessel to see how stretched out they've become and how much of that backwards flow is there. It's called venous reflux, and that's what diagnoses the failure of those valves, which leads to the venous insufficiency problem. Once we've got your diagnosis accurately made and we know which vessels need to be treated, there are multiple treatment options depending upon what the vein size is and which veins we're talking about. The most common and the first procedure that we typically address is the deeper veins in your system that are leading out to all the super veins in the leg skin and whatnot. So those deeper veins are treated by an endovenous procedure where a catheter is passed through the vein on the inside. This is painless. The only thing that you'll experience is a small numbing at the skin level where a small incision is made in order to get access into the vein. Once the catheter is appropriately placed in the vein to be destroyed, we have two different methods that we can apply. One uses heat, which will cauterize the vessel and burn it close so that blood flow can no longer occur through that vessel. The second method, which is a newer procedure, which also works just as well, is a gluing procedure where glue is administered on the inside of the vein, and by holding pressure to the outside, the vein walls are opposed and are glued together. This again effectively stops the blood flowing through that vessel so that the venous reflux will be destroyed. Once these veins that are deeper in the body are taken care of, then we examine some of the varicose veins that are also focally symptomatic and problematic and are at high risk for having blood clots or causing focal symptoms. These are addressed by a chemical injection called sclerotherapy. Sclerotherapy is a detergent that is injected into the vein that will kill the vein from the inside. Over time, your body will simply destroy the vein, chew it up, and get rid of it over time. These are the most effective treatment methods today that work very, very well at getting your venous insufficiency under control.